Good evening. We're going to get started here in just a moment. We're going to give people some time to sign into Zoom. But while we wait, if people would like to share where they are joining us from, I'm joining from the greater Chicago area. You want to drop in chat where you're joining us from or what you're excited to hear about tonight. We would love to hear that. Ooh, North Carolina. Heard it's really pretty there. I have not been there yet. All right, we're gonna get started. Welcome to Backbones, Women and SCI Health Talks. This program is funded by the Christopher and Dana Reeve Foundation. My name is Emily Lacey, and I'm the program coordinator. Today's webinar is being recorded and will be sent to everyone who registered via email and uploaded to our YouTube channel, where you can find past recordings. If you are new to Backbones, our organization is committed to helping people with spinal cord injuries and similar disabilities find connection and community. We do this by hosting events both in person and virtually, facilitating one-on-one peer support and providing resources to individuals with spinal cord injuries and their families when they are trying to navigate life post-injury. I encourage you to check out our website at www.backbonesonline.com to find more information about our programs. We are a community-led program that seeks to bring awareness and education about women's health in the context of SCI. Our topics and format are the results of 2 community listening sessions where women with SCI from across the country provided insights. To continue to be community-led and directed, we will send an email tomorrow with a short survey as well as a copy of this webinar, which you may freely share. The link to the survey will be dropped in the chat. The survey is 5 questions and should only take a few minutes to complete. We thank you in advance for filling this out. In addition to this recorded webinar, we also have a private only for women with SCI small discussion groups to unpack the conversation from tonight and share personal experiences and support. If you are interested in this small group, please go to our website at backbonesonline.com and click the program tab. The link is in the chat. I will introduce our amazing guest speakers shortly. We will have a 10 to 15 minute Q&A at the end of the webinar. You are welcome to submit questions for our speakers through the Q&A option or send them directly to me in chat. I will read questions that are submitted. If at any point you would like our guest speakers to clarify something, please use the raise your hand option or type your clarifying question in the chat. Without further ado, it is my pleasure to welcome Danny, Tamika, and Claire. Danny Isay is an advocate and recent filmmaker. She works full-time in digital marketing in the wheelchair industry. She holds a master's in English literature with a focus in disability studies. As an advocate, her work centers on elevating voices of disabled parents, and she is the subject and producer of an upcoming documentary, Danny's Twins, about pregnancy and motherhood as a quadriplegic during the pandemic. She lives in rural Virginia with her husband, children, and dogs. Tamika Spruce has a strong passion for disability advocacy and media. It started at 21 years old as Miss Wheelchair Michigan 2006. 2 years later, she formed Women Empowered Incorporated. Its mission was to empower women with disabilities to live their best lives. Later, she studied broadcast television and graduated with a bachelor's degree in journalism from Oakland University. Tamika has been advocating for over 15 years for access to affordable and accessible housing, fighting against voting oppression towards people with disabilities, racial and gender injustices, and health equity. Her short film, Justifiable Homicide, has been nominated and won an award, and her My Girl Story documentary has been selected for film festivals. Another important role in Tamika's life is being a wife and mother of 2 young children. Dr. Claire Pacquiao is a biopsychosocial scientist and clinician and rehabilitation psychologist with training with 30 years of clinical research experienced in diverse populations of persons with disabilities resulting from injury, illness, or by congenital causes. The focus of her program is to reduce reproductive health inequity by designing and implementing interventions that address knowledge and practice gaps affecting women with physical disabilities. The ultimate goal of this work is to promote independent self-advocacy and health equity. Rebecca Torres is our moderator for tonight's webinar. Thank you so much for being here this evening, ladies. I will now hand the webinar over to Rebecca, Backbone's Executive Director.
Thank you, Emily. And thank you for reading those amazing bios. I'm really honored to be in the presence of very accomplished women. And, you know, like Danny and Tamika, both filmmakers. And I just want to do a shout out for both their films, which are doing some festival runs right now. Danny's Twins and My Girl's Story. So I hope everyone has an opportunity to check them out sometime soon. And then Claire with her research, and that has led to a really important toolkit that we'll talk about later today, later in the webinar. But I'd love to start off with, you know, just recognizing that pregnancy is, you know, something that many women want or look forward to, but it comes with a bit of barriers sometimes, and also some joys as well, as women with spinal cord injury. And both Danny and Tamika have gone through the process and are here to share a little bit about that. And so I'd love to start off by hearing your stories, a little bit about your injury, to however comfortable you are about just sharing about your injury, and also then I'd love to go into, you know, the process of you just making a decision to become pregnant and your journey. So Tamika, I don't know if you want to start just kind of telling us a little bit about yourself and your injury.
Okay, excuse me. So I have a T2 incomplete spinal cord injury. So I can feel a little bit below my paralysis, which is mid-chest, but I cannot move anything. And I became paralyzed due to a car accident. My dad fell asleep behind the wheel and crashed into the back of a garbage truck. So I was almost 6 months old, and that was in 1985. So pretty much this is all I know, you know, being using the wheelchair.
Thank you for sharing about yourself, Danny.
Yeah, I am C5-6 quad, incomplete, but you know, I don't have really any movement above my level of injury other than spasms. I have a lot of sensation that's intact, and I was injured in, gosh, I don't even know, 2009, after I slipped and fell in a bathroom. Yeah, total freak accident.
Thank you both for sharing that. And so, like, I'm glad that you're able to, you know, one of you is a T level in injury and one's a C level, and I think sometimes that comes with some different experiences. So I hope we'll get into that in a little bit later. But let's talk about, you're both moms now, you've gone through pregnancy. So can you tell us a little bit about your journey and how you decided to get pregnant, and what went into your decision making when you were thinking about pregnancy, and also like what that entailed with the disability? And I'll let whoever wants to start.
Go ahead, Tamika.
Okay. So the the idea, or, just thinking about pregnancy and how all that, came about. So I was, still in, a committed relationship. And so I would say it wasn't necessarily, it wasn't planned. So, but, I did get pregnant shortly with my first child, who's 10 right now. So I got pregnant with him shortly before I got married. And then with my daughter, it's kind of funny. So I feel like after I got, became pregnant and delivered, had my son, my appointment, which was about maybe 2 months after or so, to get the birth control, back in. At that appointment, my doctor, she said, Tamika, you're pregnant again.
Oh my goodness.
So I was like, what? I wasn't expecting that because, I didn't get any signs that I was, pregnant, like, with my son, like, nausea and, classic, pregnancy signs. So, so they are, were born just under a year apart. And yeah, it was interesting. And I was really like, we were all, happy with my son. And with my daughter, we were a little nervous because, just had, a baby, and, he would be, just about a year old when she was born. So it's just a little nervousness, happy too, but, how we're going to, raise two children. But I was a high risk pregnancy, so anybody with a spinal cord injury, you'll be deemed as high risk. So, make sure my doctor, make sure to take precautions and make sure I don't have blood clots and, things like that. But my doctor, she, was really, good with both pregnancies. Thank God, and have to do any ignorant comments or, anything like that some people, women with disabilities receive. So she worked, a lot with high risk pregnancies and spinal cord injuries too. So, she was very familiar. So I didn't really have any, issues, say, with my pregnancy. I would just say we'll probably get to delivery, later parts. I'm gonna save that for later. But overall, my experiences with both pregnancies, I would say, was overall good. Even though it was, designated as high risk pregnancy.
So what you're saying is really interesting, Tamika, because, well, first of all, you had, I think, what people referred to as Irish twins. So
Yeah.
Congrats on getting through that. Like, I know how it is with twins, it's tough. So the other thing I wanted to mention was this is interesting. And this is like, there's a lot of, I've noticed like variety on doctors' opinions on pregnancy for people with spinal cord injury, whether it's high risk or not, which medications they should or shouldn't take. So there's a lot of like, I've noticed just diversity in opinions. In that there's not like a consensus really, it seems like, just from discussing this with other women. So here's what I did. I I mean, I'm, in a committed relationship, got married, it was our plan to have one child all along. And I decided to go to a high risk clinic. They're usually referred to as a maternal fetal medicine clinic. And I went for a consultation because I wanted to ask the doctor there, is my body able to handle this pregnancy as a quadriplegic? Is it going to be okay for me? And at that point, like, I knew I wanted one kid, but I was still a little bit on the fence. Like, I wasn't sure if my body could handle it because I just didn't have the knowledge. And also, there was a little fear of like, man, like, I'm going to lose even more independence. Like, independence so important to us wheelchair users and people living with paralysis, I feel like. And I think there's a little bit of a psychological like tug of war there. It's like, oh, I really want a baby, but oh, I'm gonna lose more independence. And and I had a little like fear, that sort of like internal ableism, I guess some people call it, where like, as somebody who needs care, I doubted myself a little. I was like, well, I need care. How am I going to care for a baby? But anyway, my consultation went so well. And I know a lot of experienced women who don't have positive experiences. I feel like mine was an example of a good experience. I came away being reassured and confident and ready to hop in bed with my husband. She was just so encouraging. And you know what she told me was that spinal cord injuries weren't necessarily high risk. She said there's more layers to it. Like, if you're higher level, like, you're gonna have to deal with certain potential things like autonomic dysreflexia, and then all of us having to deal with additional urinary issues and needing blood thinners and things like that. But she said, other than that, like, it's not really what they consider high risk. She also said that any pregnancy at any point can just become high risk. It's always a gamble for any woman. So that was really interesting. And I've just heard a lot of different things about whether spinal cord injury really is or isn't. Now, in my case, I ended up, surprise, having twins. And that actually did make it high risk. So, yeah.
Well, let's kind of get into that a little bit. Some of you mentioned there, these changes in your bodies. And so I kind of wanted to talk about, how you kind of tackled that, when your body was changing, and what, a lot of times women with SCI ask, like, well, what happens with your autonomic dysreflexia? Are you going to get more spasms? Like you said, but the bladder stuff, the bowel stuff. So can you all share a little bit about, those experiences, if you're open to that?
So with the body changes, it really wasn't outside of, as I was, as the baby was growing, using, the blood thinners and things. So that was, of course, new to me, to be able to deal with. But I pretty much kept my, independence, because, with being paraplegic and having, full use of my arms, I was able, transfer things. So that, I didn't really lose any of that until I got bigger, more like the 8th, 9th month, things start getting harder for me, to do on my own, like transferring and getting a chair, of course, and things like that, or get into like, my car. And just get used to that. And just like things that women who are, not disabled have to deal with, laying on your side and can't lay on your stomach anymore. Just things like, that other, women deal with. But as far as, the urinary tract infections or like the bowel programs, I was, pretty much was able to keep up with that. And that really didn't change. But I will say this though, what the most drastic change that had happened is that so with me, when I was younger, due to the spinal cord injury, I had a severe scoliosis, and so I have a rods in my back from the top of my neck all the way down to near my tailbone, and so they couldn't give me an epidural with my son because that was like a C-section, and so they had to completely put me to sleep. And so as they were putting me to sleep, put the tube down, they injured my vocal cord. So that's why I, talk like this with a little hoarseness because, my vocal cord got, slightly injured. So, I think that's just like, like a freak accident per se. It's not something that typically happens, when you have, pregnancy and things like that, or with a C-section. But because of the rise in my back, that's what they had to do. But as far as the pregnancy in itself, I was able to remain pretty much independent until the 8th and 9th month.
As a quad, I struggled a lot with low blood pressure, extremely low. I've always had some low blood pressure issues, especially when I initially was injured. It took a few years for me for it to level out. But the pregnancy I had my pressure was very, very, very low. It was interesting because my high-risk doctors allowed me to stay on my blood pressure medication that helps to bring it up. But I've heard that other doctors disagree with that. And it was sort of interesting to learn like the philosophy that my high-risk team of doctors had around drugs was sort of like, just sort of assessing the risks, all the risks, so is this person better off staying on this medication or not, and just weighing the pros and cons. And I guess this one class of medication is like it's called midodrine or midodrine. There's just not enough studies on it, I think. So anyway, so they let me stay on it, but even when I was on it and increased my dose, my blood pressure was still really low. So I was lying down on the couch and in my bed a lot. I had a lot of trouble just eating, functioning. Like I have a full-time job. I had terrible brain fog. It was so hard to focus and I was so fatigued. It was tough. So I be prepared for that if you're a quad. And I have heard from other friends who had similar issues. But to me, I knew it was temporary and just worth it in the end. And when I had the girls, it went back to normal. And actually, I think my blood pressure is like improved now. No, it's been 2 years since I had my girls, but it's like a little bit, it's not as low as it used to be. That's interesting.
It is interesting.
Mhm.
Well, let's get to the moment when it's time for the babies to come. What was your experience once, you were ready to give birth in the hospital and that whole process? I know, Tamika, you mentioned one of your children ended up being a C-section and one was a natural birth. And so, yeah, if you don't mind sharing a little bit about that.
Yeah. So I was, advised by my doctor, that the easiest way for me to deliver is through C-section. And so that's why I had a C-section with my son. Now with my daughter, she was supposed to be a C-section as well. However, it was, and I think she was scheduled like 2 or 3 weeks out from when my son was born. But I was on a computer, typing, and I just started having contractions. And so I called my mom and I was like, I'm having, feel like contractions. What should I do? And so my mom told me to call, the doctor. And then I told the doctor I was having contractions. And then they said, well, you need to, call the ambulance. And so, that's what I did. And then I called my mom back and, telling her, I called the ambulance to come get me. And so she told me she was so frantic and running around and dropping her keys and everything, trying to, fly, to get, to me because we don't live too far from each other. And then my husband just so happened to, come home at the time that the ambulance got there, that my son was sitting in this high chair eating. So it was like very, frantic scene. I'm like, oh my God, hope I, end up having a baby here and stuff. So I was, very nervous. And so, and then my husband, like I said, got there when the ambulance was there, and my mom came there shortly after, and after I left. And then, so once I got to the hospital, my water broke pretty much as soon as I got there. And then it's like, oh my God, and your water broke, so we got to rush you back, So my husband was there by that time. And, the doctor was there, and she just started coming. And it's like, we can't do a C-section, because she's already starting to come out. And so they said, is that okay? And I said, yeah, that's okay, Logan. She's good and everything. And so, she just slid out practically, my body just, happened to push it out. And so what I did feel was like kind of like a pressure on the top of my head when she, rushed out. And so that was pretty much it. And then she was here. So it happened, all within pretty much 45 minutes to an hour. So it was really, really quick. Yeah, so that's pretty much, then like I said, didn't have a chance to do, with the C-section, and luckily it worked out that way. So
Wow, your daughter was just ready to come into this world, really, from the very beginning.
Yeah, she is, and she's 9 years old now. So that's my baby.
Danny, what was your experience like?
Oh my gosh, it was wild. Not to scare anybody, but I went into early labor, which is pretty common for twins. So I was sort of like just expecting that. Like around 24 weeks, I started being really vigilant. Just like trying to pay attention to everything in my body. I was starting to get, I started getting what are called Braxton Hicks contractions very early on in my pregnancy, like starting at 20 weeks. And those are almost like mini contractions, like little practice contractions, I guess you could call it. Claire will be able to explain it better, but I had a lot of those. And I had a lot of like questions and confusion about what going into labor would feel like. I was really worried about it, you know, because I do have some sensation. It's not total. I'd never had a baby before. I was having these Braxton Hicks contractions that might have been also triggering spasms in my abdominals. I don't know. So I didn't know, like, you know, it was pretty confusing. So, and my whole stomach, when I got these little mini contractions, my whole stomach would like squeeze and turn into a weird shape. Like it would get like really taut, and like I could see the forms of the babies. It was really kind of weird looking. But yeah, so my water ended up breaking at 34 weeks. It was in the morning. I was finishing up my my routine, my bowel routine. I was getting in the shower. My blood pressure was high, and I thought it was high. Like I would get a little AD with the Braxton Hicks contractions. So I thought, oh, I'm having little Braxton Hicks, and it makes my blood pressure pop up a little. Okay, whatever. And I get in the shower, and I get out of the shower, and there's just get on my chair, and my chair's wet. And I was like, oh, it must have like, I thought it didn't like dry off enough, and like the water poured all over my chair. But I was starting to go into labor, and like it took me a while to figure it out. And I called labor and delivery, and sure enough, just like they had been telling me over and over again, you're gonna start getting like more and more regular contractions, like closer and closer together, that get stronger and stronger. And that's exactly what happened. And I felt it. And I felt a lot of pressure down there, like a lot. It was heavy. It felt like there was a kettlebell down there or something. Like it was heavy. I had 2 babies in there too, but they were at that time, they were 4 pounds each. So so then we had to rush down to UVA, which was 45 minutes away. When I got to the hospital, they checked the heartbeats, the heart rates. I had AD. I wasn't too worried about that because I knew that if there was any issues, they could take care of it there. Like AD is treatable. And they did a cervical check, and they're like, oh, you're 7.5 centimeters dilated. And the baby A is, its butt is starting to stick out. So they had to do an emergency C-section. And yeah, that was pretty scary for a minute. Especially like with twins, there was some, you know, there's extra complications, and you're worried about the second baby. They need to get out in time, you know. And there was just a lot going on. There were tons of people in the OR because there was a team for me. There was urology in there, anesthesiology to do spinal tap to get my blood pressure under control. Sorry, the sun's hitting my face. There was a team for each baby because they were prepared to take them down to NICU. So it felt like a community center in there. It was loud. The OR was loud. I was like, whoa, this is wild. But once that spinal tap hit, I was good. I felt better than I feel like on a regular weekday. I was like, oh, this is nice. Like, I don't have any pain like I usually do. And I just laid there while they worked on me. And the C-section was a little extra complicated because I have a urinary diversion surgery called them intraphenol. So they had to like, it was cool watching the obstetricians like talking to the urologists about how to go about the surgery. And I really trusted them, and they were checking in with me, and it was a good experience considering it was like kind of crazy and you know, an emergency scenario. Afterwards was the hardest for me. Because at that point they took the girls to NICU. I literally only got to see them in 30 seconds. And then I had to wait 24 hours before I could go down to the NICU to see them because they needed me to stabilize, and my blood pressure went quite high after I delivered. It was high, you know, when I got to the hospital, but it went much, much higher after I delivered, which I didn't expect. I thought, oh, after I deliver them, everything will be over. No, because at that point, the uterus starts to contract, like shrink really fast. And I could feel those contractions, and those were triggering my AD really badly. And my blood pressure did shoot up to like, you know, 200 over something. And so they gave me, you know, medication to get the pain under control, and then it was fine. But yeah. And then I actually did have some issues with AD for a couple weeks after that, just recovering from the C-section. And the other thing that was triggering it was when my milk was coming in, or when I like was engorged. So figuring out breastfeeding was a little tricky for me in terms of like a lot. There was a lot. That's a whole nother story. But anyway, okay.
Well, thank you both for sharing that. And I think we're getting some questions in the chat, and we'll have some time at the end to address those. But I wanted to bring in Claire, because I want to go into talking about some resources as women with SCI and, you know, getting pregnant, what's out there. And someone in the chat earlier said like there's hardly any information, and so welcome, Claire. Thank you for being patient. And I'd love to hear a little bit about your work, and I know you have some slides to share too on some of the work that you're doing and some of the resources available to women.
Sure. So hi, everybody that I can't see. I'm glad you're here. I'm gonna, like a true academic, of course I have slides. So I'm gonna share with you, hang on 1 second. Hold on, let me put this in. Okay. So Emily introduced me. So I'm a psychologist by background, and all of my work focuses on some aspect of reproductive health. And so this project was funded by the Nielsen Foundation. And when I started to do some work just more broadly in women with disabilities, I kept hearing these stories over and over again of women saying they would sort of spin for years trying to decide, is it right for me? Should I, shouldn't I? And there are not a lot of really good, clear answers. And I think, Sarah, you had put in the chat about, you know, the difficulty finding information and not having the internet at the time you were deciding, and having just basically, you know, physicians shut you down. I think things are better, but there's certainly a lot we can do. So one of a couple of the things of this project was to understand among women with SCI, what was the experience like of decision making, kind of irrespective of when you did it? What were things like what women needed to know, what was important to them, and so forth. So I certainly did not do this project alone. So my colleague Elizabeth Langen is a maternal and fetal medicine physician, so she knows an awful lot about pregnancies and high-risk pregnancies. And Tamika, among some other women, were our advisors. So women that had experienced pregnancy that had spinal cord injury were an important part of making sure that we weren't leaving important things out, and we had the voice of the very people that we were serving as part of the project. So really briefly, decision-making tools, and some of you may have used them for other medical decisions, are basically to support people in making what are often complicated decisions and to give information to make those decisions. And so our intention with making this was to give women guidance on the things that they needed to think about and talk about with healthcare providers, by one, but also their family, their partners, and so forth. And we really looked at it like a tool of empowering them or arming them with information that oh, sorry, I didn't spell out my acronym, to really expect that she would work closely with her healthcare provider for shared decision-making, which is what SDM meant, and really cover the bases, because every pregnancy is unique no matter who you are. So the project involved a large survey, and we had about 100 women with SCI answer that. I'm not going to go over that, but I did want to talk about one thing. So one of the important sections of it was, what information did you need to help you make a decision? And I thought it was important to give you kind of a broad view of what that was, looking at a pretty diverse group of women. And so none of this should probably be a surprise. Things that are pretty specific about function, you can see at the bottom, like balance, walking, breathing. You can see there are fewer of the overall sample needed, it because that may depend on the level of injury, but not surprisingly, caring for an infant was the top thing that nearly, a vast majority of the group really wanted information about. And Danny had talked a little bit about that, about thinking about how she was going to undertake that. But these are pretty standard things. And I just wanted to give a snapshot that these are, this kind of information is lacking in how easy it is to find and the quality of it, but are very important for decision-making. So I don't think any of that will be a surprise. So when we thought about designing this tool, we used the survey results to help us think about where to focus the content. We looked at other tools. We had Elizabeth, who's a physician, so she really guided, like, these are the really important things that need to be part of this. We did it using a web-based platform. We had a mix of content, and we really tried to keep it neutral as possible, because the goal wasn't to push women to make a decision in a certain direction. It was really to help her figure out what was right for her for this, because again, everybody's different. So I'm going to show you some screenshots, and I think you're gonna, so this isn't quite ready for prime time, but if you go to the small group, I think you'll be able to navigate this, and you can look at it in a little bit more depth. But I just wanted to give some screenshots. We really tried to have a lot of diversity in the images that we use, because all sorts of people, have babies. And I'll tell you a little bit at the end of what kind of our vision is for the kind of the long term. So these are the topics within the website. These, again, were informed by other decision-making tools, what women had said was important in the survey, but also what we know is important in this kind of decision-making. So lots of topics. It was a little hard to not go overboard with too much. And this is just, again, screenshots about, why this decision, how this is going to help you, what it's intended to do. We also had quotes from women in the tool, and these have been women that either had participated in the survey, that we knew had been in other studies, and we asked them to share some of their experience, because that's really important for hearing the voice of your peers in a really important decision. And we really tried to frame it that, pregnancy may not be the right option for everybody. There are other ways to be a parent, and not to feel that that wherever they were in this decision-making process was okay. So, and this is just another graphic of all the people that can be involved in providing care. So when we made this tool, we wanted to pilot test it. And then you do that before you do a big clinical trial where you have a lot of people and a lot of resources. You want to get some idea, like, is this even promising? Is this going to work? So our goal was 40. It was a little bit hard to find women who were kind of at this right spot of they were either planning it or they were deciding for the near future. So we did enroll 23 women, and I think all but 2 stayed in the trial. The goal wasn't for them to make a decision, but to get them a little closer to making one. And so we looked at how ready they were to make a decision, how certain they were, did they have support for the decision, and how and what they valued. And so Danny had talked about independence, and those are the sort of things that you need to weigh in making this decision, and all the other things that you may value in your life. And then we collected feedback about using the tool. And so I wanted to just show you I think I just have 3 graphs. Maybe I only have 3. So one of the things, so we measured at the beginning of the trial, 6 weeks and 12 weeks. So one thing we wanted to know was, did it move women a little closer to making a decision? And remember, the goal wasn't decide, it was just get closer. And you can see here, this is the beginning of the trial. You can see they were pretty well distributed along. They were considering it all the way to, I made a decision, I'm unlikely to change my mind. And in the middle, you can see it starts to trend toward more certainty. And then by the end of the trial, you can see about half the women had made a decision, and we actually didn't ask them what they decided. They made a decision and felt they were unlikely to change their mind. So that did what we expected it to do, to help them be more ready, whatever the decision was. And the other thing we measured were these 3 things: the clarity of what they valued, support for the decision, and how certain they felt. And you can see that it all trended upward, which is what we expected. So the higher the score, the more the more of that thing that we're measuring there is. So greater clarity of values, greater support, and greater certainty. And so you can see here where they started out, and all of these scales, I think, go to 15. So you can see among all of these things, the women knew what they valued. So you can see it didn't change a whole lot. This is this light blue line. They also had a lot of support for decision-making. It went a little bit up, but they were but you can see certainty among the 3 was the lowest, which makes sense. They were in the process of deciding. So using this tool for 12 weeks at their own, I should have said, at their own pace, just however they wanted to do it, you can see change quite a bit over the course. So they felt more certain, which is what we expected. And so we asked them how it helped them to make a decision. And really, it really gave them the things that they should be thinking about and having conversations about. And in the tool, and you'll see if you go to the small group, their worksheets, it's a little clunky. I mean, there's things we can redesign, but the idea was to give them structure to help them think about, again, what was relevant to them, to help them have conversations, feel empowered to know what to ask, and to really think about the whole spectrum of things. And I think a few of these comments, and I may not have put them all in here, is like, I thought I kind of knew everything, but boy, there was really a lot more to it. And I think that's really how it works well for them. And then we asked them, how do they think it could help other women? And by and large, they felt pretty positively. There were comments like it could be maybe designed a little bit easier to navigate, and we expected it wouldn't be perfect right out of the gate. And worksheets, they by and large felt were helpful. It kind of organized the information, but sorry, I've timed myself, I'm almost done. It could have been better organized, make it a little bit easier to use. So the upshot is it's promising to help women feel more informed about the decision, help them feel more ready, whatever the decision is, and really help them with information to provide different aspects of the pregnancy. The last But, you know, it could be improved, which the next time we'll do it. So what's next, let's see, is we're going to make modifications and then we'll roll it out to a bigger trial, and then we'll have some sort of comparison, probably like a tip sheet. And the last thing I'll say is what we would like is we know, and if it works in a bigger group, it can be tailored. So it can be tailored for other groups of people that may have additional issues to contend with. And it may be useful for people who are transgender or may have to deal with other cultural considerations or additional bias that people often have to face. So that's the long-term vision of what we'd like to do. But so far, it's looking good. So you are free to write down my email and feel free to, I can't see the chat yet. I'm going to stop sharing in a minute. But you're always welcome to email me if you have any questions. There's a lot more we learned, but not enough time to talk about it. But please feel free to email me. So I will stop sharing. Okay.
Thank you, Claire. That's really a great resource and tool, and I'm looking forward for that to come out publicly. And like Claire mentioned, we will be in our small group that we have in 2 weeks. We will be looking through this toolkit and sharing it with the women that join that group, and just kind of going through it. But yeah, we need more resources, right? And I think a lot of people want and are looking for information, and it's lacking. And so I wanted to go back to, before we go to the questions, I just wanted to go back to Danny and Tamika and ask if you had, if there was some resources that you used, or maybe people or information or groups that helped you facilitate your experience.
So for me, I think what Claire, has done is, it wasn't out, of course, when I was, pregnant, but I think it's that I definitely recommend looking more into that. But as far as with my pregnancy, what helped me the most was being around other women with spinal cord injuries. And I met them through the Miss Wheelchair Michigan program. So like, all the women, well, a lot of the women, had children, also had spinal cord injuries. So really what helped me was finding that tribe that could, understand and, that could mentor me, and, I could, ask for advice on, raising children as a woman with a spinal cord injury. And I had like a good support system as well, which always, of course, helps.
Yeah, I 100% agree. I mean, some of the first women I just met or saw visually just as mothers, Monique Stamps, she's in here. That was one woman very early on in my injury that I noticed that she was a mom. And Shannon Minnick was another one. When I was in rehab, I met her. And she had kids, and it just amazed me at the time because I was obviously traumatized from a spinal cord injury at that point and never imagined that I would be able to have kids. So it's just very powerful to be able to see each other. And that's why I'm involved in this filmmaking endeavor right now. And then after that, I think personally what helped me a lot was some groups on the internet. Just not being able to get out a lot because of my disability. I'm still not driving independently, something I'm working on, but it having access to the internet and access to these support groups has been huge. I mean, I had so many of my questions, fears answered or just sort of like listened to. There's, let's say, wheelchair mommy group or something like that. I can't remember which one.
Mommy. Wheelie mommies.
There's Wheel Mommies, which isn't as active now. There was another one that was really helpful called the Wheelchair Mommy.
Oh, okay.
Yeah, that one. And just general women's spinal cord injury or wheelchair groups helped tremendously with all the little specific questions I had that, the doctors wouldn't necessarily be able to answer.
Right. Well, we're hoping that through these webinars, we are able to provide some sort of resource as well for other women. We have a couple minutes, and I want to go back to some of the questions in the chat. And one of them said, if you have incontinence at the end of your pregnancy, is it hard to decipher water break versus incontinence?
For me, it was. Because that was definitely a question. I was like, well, did I just have incontinence? Because I had incontinence for most of my pregnancy. So yeah, that was definitely a thing. Definitely something to watch out for.
We have another question, says, are C-sections standard for SCI mothers?
Yeah, so I don't know other women that I know who had, or what other woman that was at a spinal cord injury and it was a C level. She had her child a natural birth as well, as my daughter. So, but my doctor told me that is, standard, that they usually recommend a C-section just to be safe.
They actually, so I had a different experience. They recommended vaginal because they thought it would be easier for me to recover from. We knew the odds were slim because I was having twins and there's just so many like wild card factors in that. But, best case scenario would have been a vaginal delivery for me, according to the doctors I had at the time. So it's just interesting that there's these different opinions. I'm really curious, Claire, what you have to say about it.
Yeah, I think that probably over time, the recommendations change. And I don't have the answer at my fingertips, but part of this project, and we had another project for pregnancy decision-making just for women in general, with disabilities. And so we've done a systematic review. So I'm going to look up that because I suspect it changes over time. And I don't know if it's like expected of every person, but my guess is that less and less. But I will find out, and I will send it to Rebeca, and then you can share it. I can do my best to see at least what the literature says about what the what recommendations there are or what tends to be common.
Thank you.
If I could just pop in and say real quick, what I personally wished that they would have done was more frequent cervical checks. And I'm not a doctor, I'm not in charge, but I know that would have made me at least feel more secure because again, there's that confusion of not knowing what it's going to feel like and all of that, and the added, confusion because of sensation issues. So
Yeah.
Thank you. Well, this has been a really great, great session. And I know in the chat, we've had some really great comments, people thanking for sharing your experience and hoping that this information gets out to other women with SCI that are, interested and thinking about becoming pregnant. Thank you all, Tamika and Danny and Claire, for sharing your experiences, what you're working on. And I hope that the people will watch this webinar after too, because it will be recorded on YouTube. So Emily, I know Emily popped back on and she's gonna wrap it up for us.
So I just dropped in the chat the link for our next webinar. So thank you so much for coming tonight. Our next webinar, so the chat is or the link is already in the chat, is preventative healthcare. It is in July 13th. We're going to have more topics announced hopefully very soon for late summer and early fall. Please remember that if you are a woman with a spinal cord injury, we are hosting our small groups, which we've talked about a lot. And like we said, we're going to be playing with Claire's new toolkit. And we appreciate all of you taking some time to fill out the 5-question survey. I realize that the first link survey was incorrect that we dropped in chat. It has been corrected, it is in chat. And of course, this webinar will be available tomorrow via email and on our YouTube channel. And a huge thank you to Danny, Tamika, and Claire for being our guests tonight. I hope everybody has a great day.
Thank you. Good night, everyone.
Everybody.
Thanks. Good night.
Yeah, bye.